Have you ever wondered how modern medicine is moving beyond just treating symptoms, like literally rebuilding deteriorating tissues from the inside out,
Mm-hmm.
and doing it using, of all things, fragments of marine DNA?
Yeah, it's a massive shift in how we approach healing. We're talking about moving past, simply managing a patient's discomfort with temporary fixes
Right.
and moving toward actual structural repair at a cellular level.
Well, welcome to the deep dive. You and I are jumping into a really fascinating intersection of biology, regenerative medicine, and, well, intimate wellness today.
It's a huge topic.
It really is. We've got a stack of research here ranging from cellular biology papers to clinical trials on vulvovaginal atrophy, plus some comparative studies on biomaterials.
Yeah, lots of data to get through.
Definitely. And our mission today is to really understand how the viscoelasticity, and specifically the three-dimensional gel structure of polynucleotides, can provide immediate physical hydration and long-term healing to atrophic mucosa.
I mean, it sounds incredibly technical when you frame it like that.
It does, yeah.
But the mechanics of how it actually behaves inside the human body, it makes total sense once you look at the underlying chemistry.
And that is exactly what we're going to do. We're going to focus heavily on the what and the why. But before we can appreciate this marine DNA solution, we have to really understand the hostile environment we're trying to fix.
Right, the baseline.
Exactly.
Yeah.
So let's talk about the atrophic mucosa, specifically looking at vulvovaginal atrophy, or VVA.
Yeah, to understand the intervention, you have to grasp the severity of the baseline condition. During peri and postmenopause, a woman's body undergoes this dramatic hormonal shift.
Huge shift.
Specifically, estradiol levels absolutely plummet. We're talking about falling from premenopausal peaks of around 800 picograms per milliliter all the way down to below 30.
Wait, let's just pause on that drop for a second. Going from 800 down to 30.
Yeah, it's severe.
That is staggering. It's literally like draining an entire reservoir down to a puddle.
That's a good way to put it.
And the physical consequences to the mucosal tissue are severe because, well, that tissue relies on estrogen to maintain its architecture.
Mm-hmm.
The sources point out that without it, the tissue physically thins out.
Mm-hmm.
It loses its rugae, which are, those natural folds that give the tissue its ability to stretch and expand.
Yeah.
And it just becomes completely flattened.
And the biochemical environment collapses right along with it. That lack of estrogen leads to a drastic decrease in the healthy populations of lactobacilli.
The good bacteria.
Right, the good bacteria that keep the vaginal ecosystem balanced. Without them producing lactic acid, the local pH rises way above its healthy acidic range of 4.0 to 4.5.
Which opens the door for pathogenic bacteria to thrive.
Exactly.
But reading through the clinical reality of this physical thinning, it's incredibly distressing. The mucosa becomes so vulnerable and fragile that it suffers from petechiae.
Those are painful.
Yeah, these tiny spontaneous bleeding spots just beneath the surface. And patients experience micro tears from even the lightest contact.
Right.
This leads to profound dryness, severe itching, burning, and intense pain during intimate activity.
It fundamentally impacts a person's quality of life. The connective tissue beneath the surface, the lamina propria is just completely compromised. The collagen is gone. The elastin is gone.
Wow.
Yeah, the structural integrity is just destroyed.
Okay, let's unpack this, because my immediate thought when reading about these symptoms is, if the primary complaint is dryness and friction, why are patients told they need something as complex as marine DNA?
That's the big question.
Right. Like, why can't a simple over-the-counter water-based lubricant fix the problem? If you're dry, you add water, right?
Well, if we connect this to the bigger picture, that is the most common misconception. And it's exactly why so many patients suffer for years.
Because they just keep using lube.
Exactly. We have to look at what a water-based lubricant actually does. It provides temporary surface wetness, but water evaporates.
Obviously, yeah.
A lubricant does absolutely nothing to change the underlying tissue architecture.
Because it's just sitting on the surface.
Right. The mucosa doesn't just need to be wet. It needs its structural integrity and elasticity restored. As we just discussed, the underlying collagen and elastin fibers have been depleted.
So adding a basic lubricant is just creating a temporary slip and slide on top of a crumbling foundation.
That's exactly it. The tissue is still tearing underneath.
Okay, that makes perfect sense. Simple liquids fail because they don't provide any structural intervention, which naturally brings us to the unique physical properties of polynucleotides, or PNs, and how they function as that much-needed architectural support. Let's break down what PNs actually are.
Sure. Fundamentally, polynucleotides are biopolymers. They're long chains of nucleotides, which are, the basic building blocks of DNA and RNA.
Okay.
For medical use, these are highly purified, natural origin fragments primarily derived from fish tissues, specifically trout or salmon gonads.
Which sounds wild at first.
It
But
does.
DNA is DNA. The building blocks are universal. A single nucleotide is made up of a nitrogenous base, a pentose sugar, and a phosphate group. But for this specific regenerative medical application in damaged tissue, not just any polynucleotide will do, will it? Our sources emphasize a strict structural threshold.
Yes, they do. To achieve the physical properties required for actual tissue repair, shrew PNs must have a very high molecular weight, specifically 1,500 kilodaltons or more.
Let's translate that for a second. 1,500 kilodaltons. What does that actually mean in terms of scale?
Think of it like building materials. If you have a chain of, say, 50 kilodaltons, you essentially have a handful of loose bricks.
Okay, so not very useful for holding things up.
Right. But at 1,500 kilodaltons, you have a massive interconnected steel framework. It is a long, heavy, dense molecule.
Wow.
If the chain is too short, it simply will not work the same way in the body.
And here is where the chemistry of hydration comes in, which is the core of how this works. Those long DNA strands are absolutely rich in phosphate groups. And because those phosphate groups are highly hydrophilic, meaning they aggressively attract and bind water, they pull massive amounts of moisture into their structure.
This is the critical mechanism. Because they bind so much water, and because they are such heavy, long chains, these polynucleotides don't just act like a liquid puddle in the tissue.
What do they do instead?
They polymerize. They tangle together and form a robust, three-dimensional, porous scaffold. It becomes a dense hydrogel within the mucosa.
So instead of just throwing a bucket of water onto a dry sponge, it's like injecting a microscopic water-trapping sponge directly into the desert-like tissue.
Yes,
And that sponge holds the moisture exactly where it's needed.
that is an excellent way to visualize it. And that 3D scaffolding is what creates the viscoelasticity we mentioned earlier.
Viscoelasticity.
Right. It's a fascinating property. It means a substance has both the fluid properties of a liquid to provide hydration and the elastic properties of a solid to provide structure.
So it's basically a shock absorber.
Precisely. By sitting within the tissue as a viscoelastic gel, it physically mimics the flexible, shock-absorbing properties of healthy, youthful mucosa.
No.
Yeah. When pressure or friction is applied, the gel absorbs that mechanical stress. It allows the fragile tissue to stretch, to compress, and to move without tearing.
Which immediately relieves the friction and the fragility associated with vulvovaginal atrophy.
Exactly.
Those tiny bleeding spots, the micro tears, they stop happening because the tissue now has this internal shock-absorbing shield taking the brunt of the impact.
It provides an immediate mechanical benefit. You aren't just wetting the tissue. You are restoring the physical barrier and the pliancy of the mucosa from day one.
But wait, I have to push back here.
Sure.
A sponge eventually dries out.
Right.
Even a microscopic, highly advanced marine DNA sponge.
Sure.
If this gel is organic, the body's going to recognize it and break it down, right? Doesn't the gel just dissolve over a few weeks and leave you back at square one?
You would think so, but that breakdown process is actually the second phase of the treatment.
Really?
Yeah, the gel doesn't just disappear. It sacrifices itself to trigger a biological response.
Here's where it gets really interesting. So the gel actually sacrifices itself over time, using its own breakdown materials as instructions for the body cells to rebuild the tissue.
Yes, it is a brilliant dual-action mechanism. What's fascinating here is that the physical viscoelasticity protects the tissue right now, while the chemical breakdown guarantees the tissue is biologically stronger later.
That's incredible.
Because this 3D gel is organic DNA, it is subjected to gradual enzymatic cleavage by nucleases. Those are the body's natural enzymes.
So they act like tiny scissors,
Yes.
slowly snipping away at those massive 1,500 kilodalton chains.
Exactly. And as the gel slowly degrades, it gradually releases small nitrogen precursors into the surrounding tissue. We're talking about nucleosides, individual nucleotides, and nitrogen bases.
And the gradual part is the key to why this works, isn't it?
Oh, absolutely.
Because the gel is so incredibly dense and heavy, it takes time for the enzymes to break it down. It doesn't just flood the system and wash away. It ensures a sustained, long-term stimulation.
That sustained release is the whole ballgame, because those specific precursors actively bind to and activate A2A receptors on the surface of local cells.
Activating those A2A receptors sets off an entire biological cascade, doesn't it?
It triggers three major responses. First, it significantly downregulates local inflammation.
Which is vital because atrophic tissue is chronically inflamed.
Right. Second, it increases angiogenesis, the formation of new microblood vessels. This brings oxygen and vital nutrients back to the starved tissue.
Amazing.
And third, it deeply stimulates fibroblast activity.
The fibroblasts, the body's internal repair crew.
Exactly.
Once they get that continuous signal from the dissolving polynucleotide gel, they go into overdrive, right? They start synthesizing brand new collagen and elastin fibers.
Which structurally thickens the mucosal tissue from the inside. So by the time the artificial 3D gel has completely dissolved, the body has replaced it with its own natural, healthy connective tissue.
That is just wild.
It's an elegant biological handoff from a temporary physical scaffold to permanent cellular regeneration.
I love that concept, a biological handoff. Now, if this marine DNA sponge is theoretically so effective, how does human tissue actually react to it?
Let's look at the data.
Yeah. Has anyone tested this on severe cases of atrophy? Let's look at the clinical evidence.
There is a very compelling clinical study focusing on exactly this. It tracked 54 women suffering from severe vulvovaginal atrophy.
Okay, 54 women.
And the group included both naturally menopausal women and those experiencing sudden post-surgical atrophy, which, can be even more aggressive.
Definitely.
They were treated with a specific medical device that took the form of PN-based vaginal ovules.
And the treatment protocol was pretty straightforward, right? The patients self-administered 1 ovule per day for 2 to 4 weeks.
Just a few weeks, yeah.
But the formulation of these ovules was really clever. They didn't just pack them with the high molecular weight polynucleotides.
No, they added a few other things.
They also included glycerin, which acts as an emollient to immediately soften the mucosa and decrease surface itching.
And critically, they included lactic acid. As we discussed earlier, an estrogen-deprived vagina suffers from an elevated, unhealthy pH.
Right.
The lactic acid in the ovule is designed to immediately drag that pH back down to the critical 4.0 to 4.5 acidic range.
Which is so smart because that stops pathogenic bacteria from colonizing the area while the tissue is trying to heal.
Exactly. So how did the patients fare? The investigators used the Vaginal Health Index, or VHI, to assess the tissue before and after the treatment.
Which is a rigorous scale.
Very rigorous. It evaluates elasticity, fluid secretion, pH, mucosal integrity, and moisture.
Okay, so what were the results?
The outcomes directly correlated with the gel's viscoelastic properties. After just a few weeks of treatment, vaginal hydration increased by 59.8%.
Wait, let's pause there. Almost 60% increase in hydration.
Yeah, it's huge.
That is not a marginal improvement.
Yeah.
I mean, for a patient dealing with tissue that feels like sandpaper, a 60% increase is the difference between daily agony and feeling completely normal.
It is life-altering for these women. Tissue elasticity also improved by 50.9%.
Wow.
And those painful superficial petechia, the spontaneous microbleeding spots we talked about, improved by over 51%.
Think about what this means for you or someone you know dealing with these invisible, painful conditions. In just a few weeks, a topically applied 3D gel practically reversed the physical symptoms of severe atrophy.
It's remarkable.
And what really stands out to me is that it did it completely without hormones. That is a massive breakthrough for patients who have strict contraindications for estrogen therapy, like breast cancer survivors, who are often told they just have to live with the pain.
That patient population is exactly who benefits the most from this. And the safety profile seen in the study backs up the science.
Did anyone drop out of the study?
No, there was 100% compliance with 0 dropouts. Because polynucleotides are highly purified and are naturally occurring molecules recognized by all living cells, adverse effects were practically non-existent.
No serious side effects at all.
Just a few patients noted very mild transient local discomfort, like a slight tingling or burning.
Ah, okay.
But that resolved on its own in a matter of hours as the pH adjusted.
So it's incredibly biocompatible. Now, to truly appreciate the value of this high molecular weight PN3D gel, I want to play devil's advocate for a minute.
Go for it.
How does this stack up against the alternatives already on the market? Specifically, we need to compare it to the most famous hydrating molecule in the world, hyaluronic acid, or HA.
Right, HA is everywhere.
And I also want to ask about its smaller cousin, PDRN.
Let's start with PDRN, which stands for polydeoxyribonucleotides. PDRN and PN are essentially derived from the same marine source, but the fundamental difference is the chain length.
Got it.
PDRN consists of much shorter chains, falling well under that heavy 1,500 kilodalton threshold we established.
So PDRN is much lighter. That means it penetrates tissue very quickly, which makes it great for rapid anti-inflammatory action.
Yes.
But it lacks the sheer molecular weight required to form that dense, viscoelastic, 3D porous scaffold that PN creates. It can't provide that immediate physical shock absorption because it doesn't tangle into a dense gel.
Exactly. It just doesn't have the architecture. And then there is hyaluronic acid. HA is ubiquitous in skincare and aesthetic medicine for a reason. It is an absolute sponge.
It really is.
Like PN, it attracts water, but they perform fundamentally different jobs in the tissue.
There's a fascinating split-face clinical study in our sources comparing PN and HA that perfectly illustrates this difference.
Oh, that's a great study.
Yeah, they injected one half of a patient's face with PN and the other half with HA. Both sides showed significant visible improvements in hydration. HA does its job well, but the side treated with PN showed far greater long-lasting improvements in skin roughness and pore volume.
HA attracts water, but it doesn't fundamentally remodel the cellular environment the way PN does.
So what does this all mean? Let me bring up an analogy from one of our sources that I think completely nails this comparison.
I'd love to hear it.
Imagine the damaged tissue is a worn-out mattress. Hyaluronic acid is like the water that keeps a waterbed mattress plump and cushioned. It hydrates beautifully. It fills the space.
Okay.
But polynucleotides are the actual signal to the craftsman to come in and repair and rebuild the metal springs of a traditional mattress.
I really like that framing. Hyaluronic acid provides incredible volume and immediate moisture, but it does not fundamentally rebuild new tissue.
Right.
It doesn't dissolve into the specific nitrogen precursors that drive sustained collagen synthesis through A2A receptor activation.
So HA just plumps. It doesn't remodel.
Exactly. And when you are dealing with fundamentally damaged atrophic tissue like the mucosa in severe VVA, you need both.
You need the short term and the long term.
You need the immediate physical scaffolding to prevent the tissue from tearing away, and you need the cellular signaling to rebuild the foundation for tomorrow.
Yeah.
The combination of PN's physical 3D hydrogel and its chemical regenerative signaling makes it vastly superior for reversing severe tissue decline.
It's just incredible science.
Huh.
So to briefly recap the journey we've been on today, we've explored how a hostile, estrogen-deprived, and terribly fragile mucosa can be immediately shielded and physically hydrated by the aggressive, water-trapping, 3D viscoelastic scaffold of high molecular weight polynucleotides.
Mm-hmm.
And we've seen how that very same dense gel slowly dissolves, systematically releasing the exact precursors needed to activate A2A receptors, kickstart the fibroblasts, and trigger long-term cellular regeneration of collagen and elastin.
It is a perfect example of regenerative medicine reaching its full potential. We are no longer limited to masking a symptom with a temporary lubricant or a simple volume filler.
No, not at all.
We now have the technology to give the body the exact architectural support it needs, along with the biological blueprints it needs to heal itself.
It gives agency back to patients who thought their only options were temporary relief or, painful deterioration. It really changes the entire treatment landscape.
It absolutely does. And if we take a step back and look at the broader implications, if we can successfully utilize the highly purified DNA fragments of marine life to essentially trick human mucosal tissue into regenerating its own viscoelastic scaffolding, it makes you wonder,
What's that?
what other deteriorating structures in the human body are just waiting for the right molecular language to reverse their decline?
Wow. From rebuilding a fragile mucosal lining from the inside out using marine DNA to whatever frontier comes next. And the blueprint for healing is already written in our biology. We just finally figured out how to deliver the message. Thanks for joining us on this deep dive.